Meet Carla, a retired chef who was diagnosed with cancer last month. When she meets with her oncologist, Dr. Singh, an office poster says patients might benefit from palliative care. Carla is surprised, so she brings it up with Dr. Singh. "I don't need palliative care," Carla says. "That's for terminally ill people, like hospice, isn't it?" "Not always," replies Dr. Singh. She explains that while both palliative care and hospice care aim to improve a patient's quality of life and provide support, hospice is for patients who are no longer seeking curative treatment and need end-of-life care. Palliative care, on the other hand, is for anyone at any age or stage of serious illness, including those undergoing treatment. And since patients can begin palliative care at any time, there's no need to wait. "So it's not only to help control pain?" Carla asks. "Pain control can be a part of it," says Dr. Singh, "but it's way more than that." Palliative care is a medical specialty made up of professionals with different backgrounds who work together to improve patients' quality of life. Research and scientific studies have shown that palliative care may improve patients' quality of life. Think of it this way: big undertakings are easier to do when you're backed up by a team. When she was a chef, Carla depended on an entire crew to make the restaurant run, from sous chefs and waitstaff to bussers and hosts. Palliative care works the same way. From dietitians to occupational therapists, pharmacists, and other professionals, palliative care members form a team that can look after Carla's whole well-being, not just her disease. They'll also work to manage medication side effects and ease symptoms. Every patient has different needs, so their support should be personalized. And since many patients are on their treatment journey with a family member or a close friend, palliative care can include services for caregivers too. Dr. Singh tells Carla that she has patients under all sorts of circumstances, seeking various kinds of help. That includes a single mom in her 20s with breast cancer talking to a social worker about taking a leave from her job and getting guidance for her financial concerns. Dr. Singh's patient with ovarian cancer is anxious about starting a family and has intimate questions she has trouble discussing with her spouse. So, her palliative care team includes a fertility specialist, also called a reproductive endocrinologist. Carla likes the sound of being surrounded by a team of helpers she can go to with her concerns, but she has a whole lot of questions. First, she needs to know if palliative care is even accessible for her. Carla asks if Dr. Singh's hospital has team members who provide palliative care, and, if not, where can she go locally to find them? Dr. Singh reassures Carla that she will work with her to find the provider she needs. But Carla worries about the costs, too. "How will all this personalized care be paid for?" she asks. "Will my insurance cover the cost?" Since insurance coverage can differ from plan to plan, Carla is introduced to Roger, the hospital's patient advocate. He can help her navigate insurance coverage and help her maximize her options. With Roger, Carla's team is already growing. When Dr. Singh brings in Beth to help Carla with practical issues like finding rides to appointments, and Pastor Frank to discuss how palliative care lines up with her religious views, Carla is beginning to feel much less alone. As Carla reveals more of her concerns, Dr. Singh is happy to give Carla referrals to the appropriate providers. If you had a conversation with your doctor about palliative care, what questions might you ask? Thinking about where you might need some support and what quality of life means to you can help guide your conversation. Here are a few more example topics you can ask about. Who can help me with mental, emotional, and financial concerns? Do I need to do palliative care at a hospital? Or can I receive palliative care at home or close to home? If I need help on private matters, such as intimacy, body image, menopause, or fertility issues, who is available to lend support? With the help of her palliative care specialists, Carla is much more comfortable and feeling in control of her life. You can be too. Whenever you're ready, at any time in your journey, ask your doctor for a palliative care referral.